First News with Keeler in the morning on WIBX and WIBX950.com.
Dr. Kent Hall standing by on the line right now. Doc, good morning.
Good morning. Happy Monday.
It is Monday, and I have to say there's a little sunshine in the forecast, really all week long. With there's still a chance of rain, but I'll take the sun as much as we can get it these days. It's been very gloomy.
Gloomy,
yeah.
Very gloomy, very wet.
Yep, and very wet. Which I got to tell you something. You know what that does? It brings out the one bug that it brings out mosquitoes very badly, and the other thing is earwigs. They are all over the place and large. I was making an egg the other day and thought I'd put a little fresh basil in, washed the basil off, and threw it and ripped it up and threw it in the frying pan along with an earwig, because they get right inside the curly part of the basil, and they stick in there. You got to watch for that. It's me and bugs, not good these days. Okay, Doc, let's say you were at 4 to start the week or end the week last week. Where do you stand now?
Yeah, so we're up to 6.
Okay, so it is something that's growing. And are we still talking about people that are not vaccinated?
So we actually have our first patients that have been vaccinated that are in the hospital as well. They are. One is from a long-term care facility, and the other one has some significant comorbidities. But we are seeing people that are vaccinated that are getting sick enough to be in the hospital.
Wow. And can I ask you, is there any one vaccination that you're seeing more of?
You know, I don't have that information. I don't know what they were vaccinated with, so I can't answer that question.
Okay. I'd love to know that. Because I was having a conversation with someone the other day over the weekend that believes that it is, and it would make sense based on the statistics that have been laid out there. It would make sense that it would be Johnson & Johnson.
Yeah, I mean, looking just at the numbers, you're exactly right. That is what you'd expect. Although, you know, given I think that more people have been vaccinated with either the Pfizer or the Moderna, so the numbers may also tilt in the other direction.
Okay.
Total vaccination.
And then there's also that issue of pre-existing conditions.
Right, and we are seeing people. So the people that have been vaccinated and are in the hospital have pre-existing conditions. The ones that have not been vaccinated are younger and really don't have the pre-existing condition.
Wow. Okay. I have somebody with a question. Ann in Rome with something here for you, Doc. Ann, good morning. You're on with Dr. Hall.
Good morning.
Good morning.
Dr. Hall, I'd like to know, people that are coming down with COVID that have been vaccinated, do they need to be quarantined if they're not in the hospital? And the people that have come in contact with them, should they be quarantined also?
So the answer is yes. Even if you're vaccinated, if you actually have tested positive, then you should be quarantining, because that means that it's in your system and you are able to spread it. So a positive test really supersedes just the vaccination.
Now, what about, and I think this was part of your question, what about if you've been vaccinated and you've come in contact with someone who has COVID?
Yeah, so we're still going with what the CDC and the New York State Department of Health are saying there, where if you have been fully vaccinated, then you do not need to. However, I would say that you do not need to be quarantining. I will say, though, that out of an abundance of caution, you should be careful.
Yeah.
But the CDC and the Department of Health both are saying that quarantining is not necessary for that.
Okay.
Okay. Thank you very much.
All right, Ann. Thank you.
Bye.
And what are you making of what is going on in terms of the increase? I believe it was the CDC that said the other day, this is now becoming a pandemic of those who are not vaccinated.
Yeah, so I think that's a pretty dramatic statement. I think that this is still a pandemic, and whether you're vaccinated or not, this is still a pandemic. The fact that we have patients in the hospital that have gotten sick enough to be to be in the hospital, even though they are vaccinated, tells you that we're not through this yet. There are variants coming up. The Delta variant is an X factor. There's another one out there called the Lambda variant, which we're looking at because it is it also has significant mutations around the spike protein, which is what the vaccine has been formulated against. And so we don't know if the vaccine is, how reliable the vaccine is against that one. And that one still is not quite as prevalent in the United States, but it probably will be. So, again, I will say, what I've been trying to say all along, which is that we need to be careful. We're not getting back to normal. We're going forward to a new normal, and a new normal is being aware and taking the precautions that you need to take for yourself and for your loved ones.
Interestingly, I hate to say this, but we're halfway through the month of July, and before we know it, we'll be talking about schools getting back into session and going into September. And if it's anything like last year, that's when we saw things begin to increase. But we are back out again. We are no longer wearing masks. And that does mean the spread of other things like the common cold and the flu virus. Your anticipation would be that this could be a big year for the flu?
Yeah, I would think so. We had very, very little. I mean, almost none. It wasn't exactly zero, but it was very low for the flu, which tells us which makes me a little concerned for a couple reasons. Number one is, when you go a year without something, then the number of people that are susceptible actually goes up, and so you have to be concerned about that. The other is that we look at what's been going on in the southern hemisphere in order to develop our vaccine for the northern hemisphere for the fall for the flu. And because there was so little flu in the southern hemisphere over their winter, we are not 100% sure exactly what it is that we're making the flu vaccine for. So we're going to take our best guess, which is usually okay. It's certainly not perfect, but it's okay. But, we don't know whether we're going to be able to say that we're going to hit that particular nail.
All right, and then somebody asking for an update on the progress of the hospital.
Oh, the hospital is coming along great. So we are, we have, in addition to what you're seeing in terms of the steel and the brick and the outside, there's a lot of work going on the inside, and we've started probably over the last 3 or 4 months. We've actually started some of the operational things that are going to be very important for us to move into a new space, and how it is that we're going to operate in that, not just operate in terms of service, but operate in terms of taking care of patients and stuff. So there's a lot of work between now and October of 2023.
I do have to say that in the last couple of weeks, lights have been added to the floors. I assume they're construction lights, and I talked about this last week. But when you're driving in and it's nighttime or it's early morning, you see those lights from afar. It gives you kind of a feel of what it's going to look like when the building's all lit up.
Yeah, it does. It's kind of a neat thing to watch. This is really fun to kind of watch this progress and to have the whole community be involved in it. I think it's just really cool.
Doc, we appreciate it. We'll do it again soon. Thank you so much.
Thank you, everybody. Please be safe and have a great week.
You do the same. Dr. Kent Hall from MVHS.